Can you hear me?
I, am I coming through okay?
Yeah, I think so. Okay, that's perfect. Okay, it's recording. So I'll edit it down, but let's I suppose just start with hi everybody. We were inundated on Instagram with questions about my Ozempic journey, and so much so that I didn't think it was appropriate for me to answer them as a non-medic. So I have invited a renowned specialist in weight management from a company called My Best Weight, Dr. Michael Crotty, to come online and do a little recording. And I'm going to go through some of the many questions that you guys put to us, and hopefully Mick can answer some of them for us. So thank you so much, Mick, for taking the time to talk to us.
Not at all. My pleasure. I'm a bit worried about what you're going to throw at me here, but I'm sure it's nothing we don't get in clinic as well. So the
Well, I
same kind
think
of questions and queries come up around these
I
medications a
think
lot.
the most common question was, where can I get it?
Yeah, I suppose it's been very challenging. I think for a number of reasons. I think supply of these medications has been a big issue recently, and people accessing them has been a concern. I think people are probably more aware that they are an option, and people who've been dieting and restricting and trying to manage their weight for a long time are now seeing that there's different options available. But I suppose it can be challenging to find somebody who maybe has the right approach to it, who kind of has the understanding of it, who has the experience, and I suppose who can kind of support people because I get very worried. You hear about people getting different kind of medications on the internet and
Mm.
on social media and ordering them from abroad, and even people being prescribed kind of medications from somebody who doesn't, I suppose, have a particular interest in the area. And I think really for me, if we're treating excess weight or obesity or whatever words we want to put on it, it's no different than treating blood pressure or cholesterol or diabetes or asthma or depression. It's a chronic medical issue that affects people's health and well-being. It deserves treatment, but it needs to be the right treatment for the right person at the right time.
Can I ask you? I had a conversation with you a number of years ago about this, and it's something that's really stayed with me for a long time. I had said to you, that I, like many people, I've, lost and regained and lost and regained the same 1 to 2 stone, probably 10 times in the last decade. And for me, it's not a lack of knowledge or information or education. I'm pretty sure I could probably write a book on nutrition at this point in time. And for me, I've always kind of had this, terrible relationship where it would then become this, self-flagellation where, I messed up because I had a pizza, or I messed up because I had a bar, and and this kind of really negative cycle with food and relationship with food and relationship with weight and scales all kind of takes place. But you had said something to me a number of years ago saying, your relationship with or telling somebody who's got an issue with their weight to stop eating bad foods is like telling a depressed person to stop having bad thoughts. And it's something that really stuck with me. So can you talk to us a little bit about that?
Yeah, I think weight is very complicated. Traditionally, we've been told, and in society, in healthcare, in diet culture, we've been told this is, very simple. It's calories in, calories out. Have more willpower, do more exercise. You won't have a problem. If willpower and motivation were an issue, you wouldn't see people doing the insane, crazy, misery-inducing diets, the meal replacements, cutting out huge food groups and doing these things repeatedly over the course of life. Not one person I meet day to day has an issue with willpower, motivation. Everybody can, most people I meet know what healthy food is, and that's the
Mm.
challenge. It's not as easy as that. If we look at the reasons why people struggle with weight, we can look at genetic contribution. Somewhere between 40 and 70% of our risk of weight
Wow.
issues is genetically linked. About 80% of the genes that are associated with weight are coding for what's happening in the subconscious brain, a part of the brain we can't control. So the
Wow.
hypothalamus, my hypothalamus controls my temperature, it contributes to my heart rate, and it also regulates weight and appetite. I cannot think changes in my hypothalamus. That'd be like trying to think myself hotter or colder. It wouldn't work. And you'd think somebody was a lunatic if they were trying to think themselves hotter and colder. So I can't think myself less hungry or more full. We can't control that part of our brain. And so Some of us, for genetic reasons, we have higher levels of hunger hormones and lower levels of fullness hormones. So we're biologically more driven towards food. And that's not that we're sitting at home eating shite all day and not exercising. It's that at certain times, I might be at risk of taking 1%, 2%, 5% more than my body needs. And maybe my body doesn't require the same energy as somebody else. For some of us, kind of the limbic system, which is the reward pathways in the brain, is hyperactivated. So the chemical response we get from food is different. And if I get a really, really bitchin' dopamine pleasure response from food, then food is going to be my go-to if I'm tired, if I'm stressed, if I'm pissed off, if I'm happy, if I'm sad. It's going to be my reward, my sabotage. It's going to be there. And all of this is happening in my subconscious brain, and I can't regulate or control that. So, again, the patterns of eating, the food choices that we make over the course of our life are influenced by this subconscious part of our brain. And then I could literally name thousands of things, from my birth weight, whether I was breastfed, how much exercise my mother did when I was in the womb, if I grew up in a house where dieting was happening, the country I live in, my socioeconomic status, the availability of food, puberty, pregnancy, menopause, medications, mental health, sleep, screen time, ultra-processed calorie-dense foods, commuting, chemicals. Like literally I could go on and on and on. All of these things further have an impact on weight. So many of the factors that influence weight are not within our control. The biggest challenge of all is that, trying to figure out why I've got an issue with weight is a bit like eating a can of beans and then wondering which bean made me fart. That there's many different beans in the can, and my can of beans has contributed to my weight being here. The biggest problem is once my weight is here, that is then the weight that our body is defending. So within that hypothalamus, we have a set point, a thermostat, a memory. And if my weight is here, my body is now defending that, because we evolved to survive in a world where food is scarce. As a caveman, I'm not supposed to lose weight. So if my weight is here and you create a calorie deficit, you go to any slimming club or starve myself or lock me in a cupboard, and let's say my weight comes down. In response to losing weight, number one, what I'm doing is misery inducing and not sustainable. Number two, life throws all manner of stuff, stress and changes in jobs and change in life in front of us, so we don't have the same energy to invest in it. But number three, and the biggest factor, is our biology changes. The rules of the game change. In response to losing weight, my hunger hormones get increased. My fullness hormones get reduced. My metabolism is slowed a little bit. And the craving and reward I get for food goes off the charts. So in practice, what happens is that's why 80% of people who lose weight with diet and exercise, that weight comes back over time. We get back to the weight we were before, and those mechanisms don't reset, and we're at risk of going higher. And then my
why is it though? So like I remember also like having this conversation with you previously about this like metabolic set point, and everybody will know what that number is. I think when you ask yourself what's that weight that you always go back to, no matter if you've had a baby, gained weight, you always go back. So for me, it was always 80 kilos. I was always 80 kilos. I have been 65 kilos and I have been 100 kilos. And it doesn't matter what I do, I always come back to in or around 80 kilos. So even if I diet, exercise, I did double Ironman 1 year. I absolutely literally ran the legs off myself. I still went back to 80 kilos. And then likewise, I've had, babies, gained huge amounts of weight, And then when I lose weight, I come back to 80 kilos. So that's the metabolic set point you're talking about. So what about, so I understand what happens when you lose weight, that your body wants to come back to this metabolic set point, but the same is true on the other side when you gain weight. Is that true as well?
So it's variable. Some of us, no matter what we do, will return to in or around a certain weight. And it's not usually one number, but it's it's in around the same
give
level.
Or take. Yeah.
Other people will return to that weight, but then we may go higher, and then our the set point in our brain is like a one-way valve. It gets pushed up, and now our brain is defending that weight. And then we can lose weight, and we do lose weight doing whatever we're doing. But over time, weight comes back and it may go up higher. So we often see most people I meet, they start dieting when they're here. And I would say, when you first started dieting, did you have an issue with it? Oh, absolutely. And if you look back at pictures now, do you think now you had an issue with it? God, no, I was gorgeous. Like, I don't know what I was doing. But I started dieting and I lost weight, and then the weight came back, and then I lost weight and the weight came back. And so we see this kind of yo-yoing or weight cycling. And then, they're coming to see me and they're kind of near their higher weight. So some of us will just get back, and no matter what we do, we'll never go above a certain level. Other people, it will just be a progressive issue over time. And again, this is not something that's within our conscious control. We can try and control for our environment and lots of other things, but our weight is, it's the same as if I donate blood, okay, and my blood count drops because I've given a whole ton of blood away. My body doesn't just stay at that lower blood count. It will work hard to increase my blood volume back up to where it was before. It's homeostasis. It's trying to kind of keep the system, the car on the road, and it does the same for weight.
Wow. So basically what you're saying is it's not my fault.
So basically we're saying, this is not, struggling with weight is not willpower, it's not motivation, it's not our fault. It is genetic predisposition. It's neurohormonal regulation of appetite and reward in the brain. And absolutely, it is the world we live in, the environment, the foods that are available. If we lived in a different environment and didn't have the same stresses that we have, we wouldn't have as much of an issue. If we weren't dieting, we wouldn't have as much of an issue.
So like the naysayers told this will say, and I've heard it myself over the years. Sure, listen, would you just put down the hobnobs and put yourself on a decent diet and understand about protein, understand about fiber, understand about unrefined carbohydrates, blah 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 blah, all of the usual stuff, which I know. So like, what do you say to people who say, look, you can't say that diet is not a big part of it. It's obviously a part of it, but
So I suppose, and again, I'm not saying that diet is not a part of this. What I'm saying is that the reasons why we take certain foods at certain times may not be within our control as much as we would like to think. If I'm being mindful, if I have 100% of my energy to focus on something, I can do really healthy stuff and really good stuff. The problem is when my biology adjusts and when the world around me does what the world around me is going to do, then it's very difficult to keep our eyes on the road. From the point of view of a lot of those people who say this is willpower or motivation, they don't have any lived experience. They think I'm thin because I have willpower and I'm smarter than somebody who doesn't have an issue with weight. And they that's what they believe. But actually, they're dealing with a whole different deck of cards. They might have other medical issues, but they don't have.
It's so funny because Liz and I obviously are sisters. We grew up in the same house with the same food in the same family, and Liz has never had a problem with her weight. She's always been ballpark size 10 to 12, and doesn't matter. She struggles with like 2 pounds to go on holidays, that kind of thing. And she looks at me and she says to me things like, "Your appetite is absolutely insatiable." Like, she saw me at one stage last year eat 5 cream eggs. And I shouldn't be laughing at it, but I mean, it was like a drug that I couldn't get enough of. And she was like, sure, no wonder you're fat. No wonder you're fat. This is this kind of body shaming, And I would in turn obviously make myself feel terrible about it. But I mean, in terms of nature nurture, we're the same. We come from the same genetic pool. We're the same family, but we have entirely different lived experiences of weight.
Yeah, we do. And we do see a lot of variation within families, because this is not one gene. This is hundreds of different genes contributing small amounts. And again, you're similar to your sister, I'm sure, in many ways, but again, you're different in other ways. And we do see within families, we do see some people struggling much more than others. And there's other families then where everybody might struggle. But again, if I am dealing with higher levels of hunger hormones and less fullness hormones and more of a craving or reward from food, then I'm at risk. And then an infinite number of things then further modulates that. But again, like I said, the frustration I see in people, I meet lots of people in my clinic and they are uber successful. They've done well academically, they've done well in sports, they've done well professionally because they're hardworking, they're intelligent, they're motivated. And they try and use those skills to manage weight. And they're utterly pissed off when it doesn't work. Because how can I control all these other areas of my life? How can I be knocking it out of the park everywhere else? But why can I not get a handle on weight? Like, if it was willpower and motivation, they'd have no bother because they have that in spades. They've shown that by doing crazy diets. But again, I suppose you touched on a good point there as well, as the blame, the shame, the stigma, the bias around weight, the fact that this is we're blamed for it. Sometimes many of my patients would go to a doctor, no matter what problem they go in with. If you just lost a bit of weight, that'll get better. So weight is deemed the cause of and solution to all the world's problems. And if our weight is going up, if we don't see a number on the scales we like, that has a negative impact on us. And it's even more difficult for us to then do the things we want to do.
Which I suppose kind of brings us nicely on to the next thing, which is obviously the weight loss drugs seem to be the miracle pill, the magic cure, and it seems to be, they're everywhere. So there's like seriously two or three big classes of these drugs. So obviously we have Ozempic, which is it's a semi-glutamide drug. It's licensed for diabetes, but not licensed in Ireland for weight loss. And then its counterpart, which is called Wegovy, which is the exact same drug under a different name, but that's licensed for weight loss. It's not available here in Ireland. So basically, the everyone seems to be mad for Ozempic. What does it do? Where can I get it? And how does it work? So
yeah, I suppose when people come and see me after we've gone through their history and we look at kind of, I suppose the biggest thing for me is if or how weight is affecting somebody's life and health, because that's the premise on which this is built. There is probably, there is a distinction between somebody who's living with excess weight, whose medical, physical, psychological health and well-being is affected. That's what makes it a medical and biological issue. There's a difference between that versus, I suppose, this cultural desire to be thin. We're all told you need to be size X. We all should be the same size. This is what is beauty. This is what is desirable. This is what is attractive. So there's a difference between somebody who has a medical issue because of excess weight versus somebody who wants to be thin. Okay, and there's nothing wrong with either of those, but there's a distinction. The people who, I suppose, when I see people,
which would I be then? So me, like, I suppose that when I started my Ozempic journey, I was, I was the heaviest I've ever been. I was probably around, I was touching up on 100 kilos actually, and what is it considered a medical problem? What makes it a medical problem versus my desire to be thin? Because obviously I wanted to be thin, but I wanted to be thin because I wanted to be fit and healthy for my children is actually the real reason. And I didn't want to be on this absolute crazy roller coaster with self-flagellation and beating myself up for years.
So I suppose we without going through your whole medical history in front of the internet, it's kind of difficult. But when I see people, we go through, I suppose, their health. We go through different systems. We see metabolically, medically, are they affected? Is there snoring, sleep apnea, asthma, blood pressure, cholesterol, diabetes, pre-diabetes? Do they have a history of fatty liver disease? Do they have a history of heart disease? Do they have arthritis, joint pain? Do they have acid reflux, gallstones, history of pancreatitis? We go through kind of different systems and medically see, is there an effect on health? Physically and functionally, am I able to do the things that I want to do? Can I, keep up with the kids? Can I, go hiking? Can I, do what I want my body to do? And then psychologically, does excess weight affect my confidence, my self-esteem, my sexual relationship, my mood, my libido? How does it affect somebody? So if there is an impairment of any of those areas of health, then we consider it a medical issue. Now, this is based on if there is excess weight. That's a separate thing. So I might have an impairment of my psychological health related to weight, but I may not have excess weight because that's...
So I could be a relatively healthy weight, like a BMI of 25 or 26, but really struggling with it mentally.
Yeah, but that's not inherently the weight itself. That's society and culture and diet culture and being told we're supposed to be a different size. Now, it still is having a negative effect on person. That's why, we need to, I suppose, encourage that person not to diet, not to restrict, not to be doing all those things that are going to potentially, cause their weight to go up. And that's why we need to, I suppose, look at culture and changing the way we think about weight and talk about weight. So I suppose the first premise is there excess weight? And you can define that in different ways. And then does that excess weight affect somebody's health and well-being? And if it does, then this is a medical and biological issue. So if it's affecting my health and well-being, then it's something that deserves treatment. And when we talk about treatment, then we can talk about surgical treatments like bariatric surgery, if somebody's eligible for them. We can talk about medication options, and then we can talk about life options. And that's the, nutrition therapy, behavioral strategies, looking at sleep, looking at stress, time management, physical activity. So medication and surgery are biological treatments. They're shutting up the caveman inside my head. They're changing the rules. They're turning down the volume of my appetite system. The life treatments are more helping me as a smart guy keep my eyes on the road and follow good health behaviors. And both are important. So if I'm taking a medication or I have a surgery, doesn't mean that I don't need to be engaged on nutrition, doesn't mean that I don't need to be physically active, because that life treatment, that's going to make me healthy. That's going to make me live longer and feel better. And it's going to affect the quality of weight change, as in, if I'm losing weight, that I'm not losing muscle as well. So when I talk to people, I talk about all treatment options, and then it comes down to what's right for that person. If somebody's not eligible or doesn't want to go down the surgical route, and if they've done all the life treatments, then we will talk about medications. And it's kind of.
There's usually a big problem though with the big problem. Obviously, seems to be that Ozempic, which is the kind of the forefront, medication leading medication at this stage, seems to be a huge problem getting. People can't get their hands on it for loads of reasons, but there's other drugs available as well. So maybe we touch on those first before we talk about the problems that we've Saxenda, which is it's in the same glutamide family, isn't it? But it's a liraglutide, so you take it daily rather than weekly, and that is licensed for weight loss. Yeah,
so there's different medications available. There is worldwide supply issues that they can't make enough of these medications. Certain markets are being prioritized, and Ireland wouldn't really be kind of, at top of the pile as far as getting the supply. So supply of the medications is a huge challenge. Obviously, there's been a huge amount in the media about people using a medication that's licensed for diabetes to manage their weight, and that has been spun in
a lot of shaming going on, with that as well.
So we're told that it's, and the narrative in the media is fat, lazy people stealing medication from somebody who's got a real medical problem like diabetes.
Yeah.
That's the way it's been framed. And that's bias and stigma and discrimination. And when the Medical Council and the Pharmaceutical Union communicated with all doctors and pharmacists in the country, telling them not to give that medication to people who don't have diabetes, we pushed back and said how disgraceful this was. Like, I've never been communicated with by the Medical Council to say, don't give beta blockers to somebody who doesn't have blood pressure for treating their migraines. I've never been told, so there are many medications that are licensed, so they're kind of on the regulatory kind of documentation. They're for this purpose. Doesn't mean that they're not safe and effective to use in other situations. So again, a doctor who's knowledgeable about these will know the benefits and the risks and can counsel people around it. But the problem is, I can see somebody and have a conversation, and we can kind of collaborate and come up with a plan, and then they can bring the prescription to a pharmacy and be told, no, you're not allowed to have that.
So I had a recent experience with this myself when I brought my prescription to my local pharmacy, and they told me that they're only giving Ozempic to type 2 diabetes, for people with long-term illnesses, type 2 diabetes, etc. And I kind of kicked back a little bit at the pharmacist and said, but look, sure, isn't type 2 diabetes reversible, equally as reversible with diet and lifestyle as is obesity and, people who suffer from weight management issues. Like, they're all controllable by diet and exercise. And if it was that easy, then they wouldn't need it any more than we do, right?
But there's not the same stigma around diabetes. Diabetes is not your fault. Whereas if you struggle with your weight, that's your fault. That's the
narrative. But isn't it? Like, is it not? Like, getting type 2 diabetes it's not that I'm not saying is it not your fault, but it's as much your fault as being overweight is your fault.
So again, I suppose, they're both. I'm not saying that diabetes is not important. Diabetes is a very important medical issue, but so is the chronic disease of obesity. So, these are two. It's like saying that asthma is not as important as blood pressure, or anxiety is not as important as depression. It's kind of it's not that one is not important. It's that they're both
comparing apples and oranges.
So for me, again, I'm not saying that people with diabetes don't deserve treatment. They absolutely do. What I'm saying is that people who live with excess weight or obesity, they deserve treatment too. Now, the pharmacist can't do anything about the supply of medication. There is a shortage. And again, if it's communicated to somebody saying, look, there is a shortage in medication, we don't have it, that's very acceptable. The problem is some people are being scolded, they're being given out to, they're being mortified in the middle of a pharmacy. And that's a problem. So again, it's a case of, these are people who have already blamed themselves their entire life. So that's a challenge. But, again, there is a shortage of resources of medications available, and that's a major problem that has to be addressed. But that's going to be a short-term issue that will eventually kind of resolve itself. The stigma and biases and lack of kind of knowledge and information is a bigger issue.
That's about us learning to change our language and take away the blame and the stigma and the shaming and the it's your fault and you shouldn't, go on a diet, lose the weight, this kind of, pointy finger behavior. And the other kind of question which we were, inundated with, I can't tell you how many people sent me this message in various shapes, sizes, and forms, but their experience was, hi Nikki, I have a BMI of X, usually significant number, and I've been to my GP. My GP has told me to go on a diet or to do X, Y, and Z. Won't give me the medication. What do I do? What's next? And it seems to be that is the most common message we got after we put up that video. It was unbelievable.
Yeah, and it's very challenging. I didn't learn anything that I can remember in college about weight regulation and the biology and obesity as a chronic disease. I didn't learn it. It wasn't taught.
It's not taught in med school, yeah.
Yeah, so in med school, I didn't learn about it. When I did a couple of years of surgical training, and then I went back and did GP training, and I qualified as a GP. Again, I didn't learn anything about weight and obesity. And the idea was we were just promoting what was in society: eat less, move more. And I'm like the kind of born again Christian, that I have fallen into every hole. I have told people to eat less and move more in my previous kind of life. And then you come across the science and the evidence, and you hear people talking about this. And, I think particularly people who have had their own personal experience of weight, they understand it straight away. They understand the science and the biology because it matches their lived experience. It explains why their weight has done what it's done. And there's a lot of doctors who haven't received the education and the knowledge who are now coming
lived experience.
Exactly, and are coming across it. So that's one of the reasons why stigma and bias is very prevalent in healthcare. And as a doctor, doctors are probably the number one source of stigma and bias around weight. There isn't a medical issue or symptom you can think of that you couldn't go to the doctor and they would tell you, listen, just lose a bit of weight and that will get better. And it's a case that, excess weight is not the cause of or solution to all the world's problems. It's very important for health, but we need to look beyond weight and assess somebody for all the potential causes of their issues before we blame it on weight. So I think, for people like me, there's a huge job for me to do in trying to spread knowledge and information to other healthcare practitioners who maybe haven't received it. And, again, I can't see every person in the country. So, this is a chronic disease that needs management, and people need to be able to access that treatment, and it needs to be reimbursed by the government. They need to be able to access, whether it's life treatments, medication treatments, or surgical treatments. But again, there's a huge job for me to do to try and help talk about these things and increase knowledge and information. But it's to get beyond that stigma. Again, the communication that was sent out from the Medical Council to all doctors has, I suppose, had an impact too. And that's reinforced the stigma and bias. And that's why, a number of us wrote very strongly worded letters back, calling this out. And it made absolutely no difference with the Medical Council, but it made me feel better shouting at the void for a while. But there is huge work to be done. And I think, as time passes, as people see, I think traditionally as well, with kind of newer medications, a lot of doctors might have a skepticism or a fear of newer medications too. These medications are not new. We've been using them for 20 years.
My next question, yeah.
So
people say we've seen that. We've seen doctors even say, we had a doctor last year even say, on our stage that we don't know the long-term effects of these medications, but that's absolute horseshit, basically.
So and somebody might have been prescribing it for diabetes for years, but they just haven't been using it for excess weight. But, for me, if I'm counseling somebody and I'm explaining to a smart, intelligent person why I think they might kind of benefit from medication, that person needs to know about why they're taking it, how it works, what the chances of responding are. If they don't respond, why is that the case? What are the side effects? What are the benefits? What's the cost? And you give smart people information, they make good choices. But we need to be able to communicate that. So again, if somebody, and you hear about people getting these medications in lots of different kind of nefarious ways, the challenge for me and the what I'm terrified about is that people are not getting the information that allows them to make good choices. And I suppose the other question I'm constantly asked is, how long do I need to take this stuff for?
That's the other big thing I was going to say. So am I on this drug for the rest of my life to try and maintain my weight and therefore paying €150 a month for it?
So I suppose my answer to that would be treatment is lifelong. This is a chronic medical condition. There's no cure. It's not like taking an antibiotic that we're solving the problem. My thermostat is going to be still set here. Now, bariatric surgery, you could argue, kind of brings the thermostat down permanently, but the medications will treat the symptoms to facilitate weight coming down. But if we stop the medications, and weight is going to want to go back up to where it was before. In the
So
same
this
way,
isn't a short-term fix. So this isn't to take this for 6 months, lose that stubborn stone that I've always wanted to lose.
No.
If I do that, the chances of me regaining that stubborn stone is what? What's the stats?
So in one of the more recent studies, 70% of people have regained 70% of the weight at a year off the medication.
Wow. Okay. I wonder what that is 5 years out. Be interesting to find out.
And I would suspect it's going to be more. And again, let's say somebody doesn't have excess weight that's affecting their health, and they want to take it for, I've heard of people taking this for a month or two before a wedding or a holiday or something like that. That person may very well lose weight, but when they stop the medication, weight will come back. And those physiological mechanisms that kick in to get the weight to go back up may promote their weight going higher. So that will be the same as doing a diet.
Because I misinformed people, I suppose, on a recent podcast that I did recently. I had read something saying that, if you're on it for a prolonged period of time, that it can change your neurological pathways in your brain and your chemical relationships with food. Is there any truth in that?
The short answer is no. It's a lovely idea, and it's what we're all conditioned to think. If I get my weight down, I'll be able to keep it down. So how has that gone for me when I did keto or intermittent fasting or whatever iteration of a slimming club? I get my weight down. Surely if I'm feeling good and people are telling me I'm looking good and I'm energetic and I'm going to the gym, but why does weight come back up? For the same reason as if we stop these medications. And I suppose what I would say to people in clinic is, if I go on a cholesterol tablet or a blood pressure tablet and my cholesterol, blood pressure come down, what happens if I stop those? Well, my biology is no longer treated. So those issues are going to come back. If I take an inhaler plasma, the same thing.
I do think, well, my own personal experience is that since I've lost weight, I've found that my energy is much higher. Also a very odd side effect is that I've really no desire to drink, which is most unusual for people in my family, and very little desire to drink. And I suppose weight loss has made exercise easier. It's made my desire to be fit and healthier easier. So I assume that all those things will play into my physiological state though, and my body, I suppose, in the longer term, right?
I suppose, again, if we look at how and why these medications work, they turn down the level on biology. They change hunger, fullness, craving, desire for food. And as a result of that, the smart guy who knows about nutrition, who knows what he wants to do, is able to do those things. So these facilitate changes in eating patterns and eating behaviors, physical activity, to make me healthier long term, potentially. Now,
is there there's obviously always a reluctance for people to go. Nobody really wants to go on a medication long term. I don't know if nobody wants to, but I certainly, in my head, I'm like, I don't really want to be on a drug for the whole rest of my life. But I suppose, if this is what it means, then maybe that's what it's going to take. But is there long-term side effects, long-term risks of me being on a drug like this for years? I heard somebody in LA going on recently about, osteoporosis and all sorts of other kind of boogeymen waiting down the line for me.
If I have a medical issue, if I've got medical issues related to weight, then the benefits of these treatments far outweigh any risks. If I don't have a medical issue and I'm losing them to be thin, then potentially I could, having a weight that's too low could have a detrimental effect on my health. Like, we've been using these medications for 20 years. We know the risk of gallstones, of pancreatitis. We know the risk of nausea, heartburn, constipation, GI upset. These medications are not without risks. They're not without cost. But again, if we look at the other side of that coin,
the risk profile of being overweight.
What if I don't treat this? What if this is a progressive, complex medical issue? If it gets worse, could it contribute to other medical issues? So, that's where kind of talking to somebody who knows what they're on about and kind of teasing out, is this right for me? And again, I suppose people are not kind of signing up to lifelong treatment. They're kind of trialing something to see if they respond, because 50% of people don't respond to the medications. 50%.
And 50%. And what what do you think? What do you think somebody else texted us yesterday and said that she'd been on it for 4 months. The other one, the Saxenda, she'd had absolutely no weight loss whatsoever and no changes, no anything, and she's on the highest dose. So 50. So she obviously fits into the 50% of people that it doesn't work for.
Yeah, so there's kind of, I'm not saying 50% of people don't get any response. They may get a response, but it may not be as clinically significant. And that's because if I don't respond, it's not my fault. People do not fail treatment. The treatment fails the person. So if I don't respond, I'm not doing anything wrong. It's because it's not addressing the biological pathways in my brain that are leading me to struggle with weight. Maybe, it's not having an impact on my hunger or my fullness or my craving or reward. So maybe I need a different medication. Maybe I need a newer medication that isn't available yet. Maybe I'm somebody who needs a surgical treatment, which is a stronger treatment, which is, surgical treatment
Bariatric,
is standard,
yeah.
Bariatric surgery. So again, and equally, if I'm on a treatment now, my requirements in a year, in 2 years, and 5 years might be different. But again, there might be different medications available then, more powerful medications, better tolerated medications. Obviously, the hope is long-term that the thinking around excess weight will be different and it will be considered a medical issue. And then there might be reimbursement under drug payment scheme or medical card or different things, but that's not the case at the moment. So, again, I suppose when I'm seeing somebody, it's looking at, how are they affected? How is their health affected? Talking about all the treatment options, giving them as much information as they can take, and then letting them make a decision. The days of the doctor telling you what to do are dead and buried. This is about kind of figuring out what's right for a person
and educating yourself.
And we can't get around the biology, and we can't. Again, it's when I tell somebody that this is not their fault. They're delighted with me. When I tell them they potentially might need a medication forever, they're not so kind of happy anymore. But I can't apologize for the fact that the biology that has caused us to struggle is this way, and it needs treatment. But it's interesting, kind of when people are treated and they feel different, they'll often realize, now I know why different things I did in the past, weren't effective long term for me.
Yeah, and I can 100% attest to that. I'm only 6 kind of months into the journey, but I feel like it's been a life-changing experience for me, a life-changing drug for me, and I've had like very minor side effects, but obviously, like I'm 40 pounds down, and I feel fitter, healthier than I've ever been in my life, despite despite being a mother of 2 young babies and having a full-time job. So for me, it's been really life-changing, but mentally it's been life-changing as well about how I think about food. I don't think about food anymore. I don't have this constant internal dialogue about I shouldn't be eating that, or I should eat more of that, or beating myself up for eating something that I shouldn't have eaten. And now I think I have a normal, whatever normal is, a normal relationship with food that I imagine people who don't have these struggles experience.
And I think that the challenge is not everybody responds the same way. Some people respond more than others. And I suppose a lot of what I do is managing expectations of looking at, look, this is the average response. This is what you can expect from a side effect and benefit point of view. Many of us will never be where we want to be weight-wise. No. But
which brings us nicely on to your business, which is getting to my best weight.
Yeah, so I suppose, if people want to kind of, talk about weight in a supported way, mybestweight.ie is our website, and people can refer themselves if they want. There's lots of information on our website, even kind of, that can arm people if they want to go and talk to their own doctor as well. So I think knowledge is the key, and educating people that they understand this kind of better. But I think really people, this is not a skinny jab. It's not a quick fix. These